Hello, I'm so glad that you guys are joining us today for our presentation. We're going to discuss the importance of diabetes, dental, and eye care. Again, we just want to thank you for taking the time to listen to this PowerPoint, and we hope that you gain something from it.
Okay, what we will cover today is diabetes, nutrition, dental care, eye care, and resources. So our first topic is going to be diabetes and nutrition. Many of you probably already know someone in your life that has diabetes, whether that is your friend, your coworker, or a family member. Diabetes is a very common diagnosis, so it is very important to be aware of all of the signs and symptoms. In this photo, it shows your blood sugar level when you haven't eaten anything for the past 8 to 12 hours. We call this fasting. We measure whether you have diabetes based on your blood sugar levels. As you see in this photo, you would be classified as a diabetic if your blood sugar is measured over 126. Diabetes can be a very complicated disease, and there are different types of diabetes, like type 1 diabetes, type 2. During pregnancy, if you get diabetes, it's called gestational diabetes. But because it can be a complex condition, for today's purposes, we will stick with talking about type 2 diabetes. Diabetes is a chronic lifetime disease that could cause your blood sugar levels to be too high. Your body is unable to use sugar for energy. To use sugar, your body needs help from a protein called insulin. Think of insulin like a key that lets your sugar into your cells. If your body stops listening to the key or insulin, the sugar will stay in your blood and it will start to build up. Too much sugar in the blood can hurt your heart, your liver, your kidneys, and your eyes. So it has a really big effect on your overall body. Some signs and symptoms of diabetes that you might notice is having a really increased thirst, like even though you're drinking water and you're still hydrating yourself, you will start to feel an increased amount of thirst even when you're drinking water. You might feel really tired all the time. Even if you're getting enough rest, you still feel tired. You might notice that you need to urinate or pee more often. You might feel an increased hunger, some tingling sensation in your feet, or you might notice some very blurred vision in your eyes. When you have diabetes, high blood sugar levels can damage your nerves, including the nerves on your feet. This is actually a serious complication of diabetes because you lose sensation in your feet, making it hard to feel pain, heat, or cold. This can be dangerous because you might not notice injuries or infections, which can lead to more serious health problems. Loss of sensation might feel like numbness, tingling, or what we call pins and needles. So it's important to check for wounds in between the toes, the bottom of the feet, your nail beds. If you have diabetes, it is really important to examine your feet at least once a day. But if you can't check it daily, then at least once a week. When you shower, you should dry your feet really well and make sure you moisturize. That way, you don't get any cuts or bruising or anything that you don't notice. So it's really important to check your feet daily if you do have diabetes, since you can lose sensation in your feet and you won't notice whether you have any of these cuts or wounds that could cause infection from occurring. It's really important to set up care with a medical provider, especially if you have diabetes that you need to be in well control of, or any other health conditions that you might need to see a provider for. Um, it's important to at least see your medical provider, your family doctor, at least once a year for a yearly checkup, and to stay up to date on vaccines too that could prevent you from getting sick even more or getting infection, especially if you're someone who has diabetes or any other health condition. Getting vaccinated is really important to prevent yourself from getting more sick because of these conditions.
Hello again. So now we're going to go ahead and discuss why what you eat matters. So, as Kim previously discussed, the importance of blood sugar. The reason why blood sugar, again, is so important is because when you have high spikes of blood sugar throughout the day, that gives you a spike of energy and then results in that crash that you feel after you eat like a candy bar or a soda. So, the importance of blood sugar management is to try and eat small meals throughout the day to avoid that crash. So, to maintain your blood sugar, to give you constant energy throughout the day, also eating smaller, more well balanced meals, which we'll discuss in the next slide, helps you maintain a healthy weight and it can help you avoid complications long term, such as complications with your heart, eyes, and teeth. All right, so this is an example of a healthy eating plate. As you can see, a quarter of the plate is for whole grains. This is going to be your whole wheat bread, your whole wheat pasta, your brown rice. Another quarter of the plate is for your healthy proteins. These things would be your lean meats like chicken, turkey, or eggs, and then also like your seafood like salmon or tilapia. And then you can see there's a little bit more, about a third of the plate for your vegetable. These are going to be your non-starchy vegetables, which we'll give you an example in the next slide over. And then you can see there is a small portion for your fruits, and then it suggests healthy oils like olive oil, and then to just drink water to stay hydrated. It is important to try and avoid the sugary caffeinated drinks, as those are empty calories, and water is more wholesome and better for your body just in general. All right, so this is an example of a diabetic plate if you are diagnosed with diabetes. As you can see from this plate, it is about half of the plate consisting of non-starchy vegetables. There will be an example of what non-starchy vegetables on the next slide. And then a quarter of the plate is for your proteins. Again, those are going to be your leaner meats, such as your turkey, chicken, salmon, and then another quarter of the plate is for carbohydrate foods. These again are going to be like your brown rice, your potatoes, your brown rice, or your whole wheat spaghetti. And so, as you can see, compared to the plate before, the diabetic plate actually combines the fruit portion to the carbohydrate foods. Fruits are sugar and sugars are carbohydrates. So it's really trying to cut down on the amount of carbs that you have in your diet. It is also recommended to start with a 9-inch plate. What you can also do is do one of those smaller plates, like those plates that you would use for like a side salad, rather than your normal dinner plates, as that kind of tricks your mind into thinking that you're actually eating more than what you actually are. And so that might be a good option just to get a smaller plate to start off with, so you're not tempted to fill the plate with more food. And then here's the example of the non-starchy vegetables, and then the complex carbohydrates, and then the lean proteins that I was talking about. So some examples of non-starchy vegetables are going to be like your artichokes, your broccoli, your celery, or your cucumber. And then your complex carbohydrates, which depending on what plate you're looking at is about a quarter of the plate, is going to be where you can have your potatoes or your butternut squash or your corn, and then in addition to your whole wheat breads and your brown rice and then legumes. And then the quarter plate for the diabetic plate particularly is going to be where your salmon is, your cottage cheese, your eggs, and then your lean meats such as chicken or turkey. And then here is an example of some alternatives to snacks that you could do. We took these prices in April of 2024, so the prices might be slightly changed from current time. But we just took an example from Walmart of what the cost of Cheetos is, which is about $6, and then some powdered donuts, which is about $2.60, and then compared it to a healthier swap, which would be an apple for about 70 cents, some peanut butter for about $3.50, and then some granola bars for about $3. So when you add those up, you can see that actually eating the powdered donuts and the Cheetos is actually more expensive than the apple with peanut butter and the granola bar. The purpose of this PowerPoint is to not try to completely change everyone and say that you need to shop organic. That's not the purpose of this presentation. The purpose is to provide you with resources to try and make smaller, healthier swaps that are sustainable over the long period of time. So when you go for an apple, you have your carbohydrate, and then when you have your peanut butter, you have your fat and your protein, and then you also have the carbohydrate with the granola, which is going to sustain you for a longer period of time and prevent that sharp spike of your sugar in your blood and then the drop that you feel after eating things such as Cheetos and powdered donuts. We then create a list of some helpful resources for saving some money. So the first one would be buy generic. So an example of this would be buying like the Great Value Walmart brand milk rather than the Lactaid brand milk. Most of the time these have the same like main ingredient and aren't a huge difference. Also using coupons, there's a lot of coupons that are electronic nowadays, and then writing a list, and this is where you can actually include your family and try to get everybody on board and make it maybe a fun event. So you can write down things, you can use the plate guideline, so you can say, okay, we all need to pick a vegetable, and then say you guys pick broccoli, and then okay, what do you guys want for your carb? And maybe the kids say that you want potatoes, and then so you'll do potatoes on the side, and then what would you like for the protein? So then you can go ahead and do chicken. So then you have one meal, which is chicken, potatoes, and broccoli. And there you have one meal. And so the benefit of meal planning is that you also stick to your list, your grocery list, and so you end up saving some money because you're not just aimlessly buying things. You actually have a plan and you will actually use up your groceries, so you don't actually have that much of waste as well. And then another tip would be just shop when you're full. Don't go when you're hungry. Normally, you try to go for those quick, satiating snacks when you are hungry. So if you have eaten before, that is recommended. And then, like I said before, meal plan, and then that's a way to get your family involved. And then some affordable locations that accept EBT are Food for Less, Dollar General, and Walmart. The swap meet does not accept EBT, but normally there's only about a 50 cents to $1 entrance fee, and that could also be a really great resource for getting produce. The only thing that I would recommend is washing your produce, either when you get it at the swap meet or when you shop at Walmart or your normal grocery store. You can do this by adding a little splash of white vinegar into a bucket of water and letting it sit for about 10 minutes, and then just running cool water over the fruits or vegetables, and that will go ahead and rinse the vegetables and fruit that you have. The only reason why I'm saying this specifically for the swap meet is that they don't have specific sanitation guidelines that they have to follow. And so it's just a good idea just to make sure that you are washing your fruits and vegetables no matter where you shop.
Okay, so now we're going to transition into talking about dental care. Starting off with some general dental tips, it is recommended that you floss daily. This is important because flossing helps remove germs that get stuck in between your teeth where your toothbrush cannot reach. It's also recommended that you brush your teeth at least 2 times daily, both morning and evening. And the American Dental Association recommends that you brush your teeth 2 times daily for at least 2 minutes each time. It's also important that you're using a soft bristle toothbrush because this will help avoid any damage to the enamel, which is the outside layer of your teeth that keep our teeth nice and strong. Fluoride is a mineral that can be found in some toothpastes, and this will help strengthen the outer layer or the enamel of our teeth to help keep them nice and strong and to prevent any tooth decay. And it's also important that you replace your toothbrush every 3 to 4 months or sooner if you notice that your bristles are starting to become worn out or if they start bending sideways. That's usually a good indicator that it's time to replace your toothbrush and get a new one. Another tip is when you're brushing your teeth, it's important that you're brushing your teeth gently, and this will help protect your teeth and avoid any damage on that outer layer, the enamel, like we talked about earlier. So it's important to brush your teeth gently. We also recommend that you avoid any toothbrush covers. These are usually the travel toothbrush covers that can go over the end of your toothbrush, and it's important to avoid these just because when you use these, it can enclose your toothbrush and then it can stay wet. So this can allow harmful bacteria to grow on your toothbrush. Another tip is brushing your tongue every time you brush your teeth, because this will remove the layer of germs that can live on your tongue and help improve your breath and overall oral health. And then it's also important that you see your dentist at least once a year, because seeing a dentist regularly helps catch problems early, prevent serious issues, and help keep your teeth and gums healthy through regular cleanings and checkups. Another tip is to look for alcohol-free mouthwash. Alcohol-free is less likely to damage the enamel of your teeth, so we do recommend that you use an alcohol-free mouthwash every time you're brushing your teeth as well. A common myth that you may or may not have heard of before is that mouthwash can replace brushing your teeth, but this is false. This is just a myth. Mouthwash alone is not enough to replace brushing your teeth. It can be used alongside brushing your teeth, but mouthwash cannot be the only form of mouth hygiene. Mouthwash can help reduce plaque buildup and lower your risk of cavities, tooth decay, and gum disease, but it is important to be used with brushing your teeth, not in place of. Mouthwash can help freshen our breath and get rid of the surface bacteria, but brushing your teeth is really what gets rid of that harmful bacteria that hides in between your teeth that can cause cavities and further dental issues. So mouthwash is a great tool that we have, but it's important to use that alongside brushing your teeth and not in place of. Oral health is more than just clean teeth. It's about keeping your whole mouth healthy. Your health starts in your mouth, for example, with the food and drinks that go into it. And when germs grow, they can cause infections that can lead to cavities, gum disease, or even tooth decay or loss. And it's much cheaper and easier to prevent damage from occurring than fixing it later once the damage has already occurred. So it's really important that you take care of your smile now. Problems in the mouth can also cause problems throughout the whole entire body. The mouth connects to vital organs like your heart, your lungs, and your stomach. This means that problems in your mouth can lead to problems in these areas. Good oral care reduces the risk of developing other serious diseases throughout your body. Bacteria from the mouth can enter the bloodstream and cause infections elsewhere, including the heart. This can lead to a dangerous infection known as endocarditis, which is an infection of the heart's inner lining. It can also cause the bacteria to get into the lungs and cause an infection in your lungs called pneumonia. Poor dental health can even increase your risk of memory issues down the line, like dementia or Alzheimer's disease. Oral health also impacts our mental health. Having healthy, clean teeth can increase our quality of life by allowing us to enjoy our meals without pain and increase our self-confidence when talking to and meeting new people. When we feel good about our smile, you're more likely to feel confident in social situations. Another tip for good dental health is avoiding things like high sugar drinks like soda, candy, smoking, alcohol, and drinks with a lot of acid like coffee. These substances can weaken the enamel or the outer layer of your teeth and encourage the growth of harmful bacteria that can contribute to tooth decay and cavities.
Okay, so we were just given some really great recommendations on how to sustain good oral health. So now I'm going to switch it up and talk about some of the consequences that can happen if we don't take care of our teeth as well as we should. On this slide, we just have a small list of some of the problems that having poor oral health can cause. It can cause gum swelling. This is otherwise known as gingivitis. Along with swelling, you might notice that instead of your gums being pink, they tend to become this red, beefy color, and they also tend to bleed easily. Periodontal disease is a gum disease that leads to bone loss. If you look at this comparison picture, the picture on the top right, you can tell that in the mouth that has periodontal disease, there is a sign of bone breakdown around the gum line. So you don't have the pretty arcs that are present in the picture that shows the healthy gums. Receding gum line is also a common problem that's seen. Unfortunately, once this happens, the gum tissue doesn't grow back, and the only way to replace it is through surgery. And we also have an example of this in the middle picture. There's a red arrow that's pointing to extra tooth that's being exposed because of the receding gum line. And then bad breath, pain, and cracked teeth are also other fairly common issues that can happen with poor oral health. Okay, now to wrap up dental care, I'm going to talk about some of the services that you may need if you have any of the problems that I mentioned previously, or just generally if you have pain, rotting, bleeding, or if you have diabetes. Depending on the condition of your teeth, you may need to get your whole tooth removed. You may need to get a root canal if your cavities or infection have penetrated the root of your tooth and caused inflammation. In this dental procedure, the dentist goes in and accesses the root, it cleans it, disinfects it, and then the dentist fills it and seals it back up. A crown covering is when they put a cap over a broken tooth to help with decay and prevent further cracking. Cavity fillings is a common procedure where they drill out the dying area of a tooth and then fill it back up. If you have any missing teeth, you can get dentures or implants to replace them. Fluoride treatments can protect your teeth from cavities and decay. This is a procedure that's done in the dental office, and the hygienist will usually do this after they do a very thorough cleaning. They'll apply a fluoride gel or varnish and then have you keep the gel or varnish over your teeth for a few minutes and then have you rinse it out. And then if you grind your teeth at night, you might need mouth guards to wear during sleep. You'll know that you grind your teeth if you tend to wake up with a sore jaw in the morning. So now we're going to move on to talking about eye care. So why is eye care important? Our eyes allow us to see and make sense of the world around us. We use our eyes for every task that we do while we're awake. So on average, our eyes are guiding us for about 16 to 18 hours a day. That's a long time. And as you all are returning to society, being able to see will be important for many tasks, such as filling out job applications. If you're filling out an application online, you may be able to zoom in on any parts that are too small or any font that you're having a difficult time reading. However, if you're filling out a paper application, you won't be able to zoom in, so you'll need to be able to see any of the small print that is on the page. Being able to see is important for education, whether that is going back to school or getting new on-the-job training. You may be required to read books, use a computer, or any smart devices. You'll need to be able to see to renew your driver's license or to drive a car, especially because you'll need to see street signs and traffic lights. Good vision can also prevent you from hurting yourself. For example, stepping off a curve you didn't see, running into objects, or even getting into car accidents. Many people think that their eyesight is just fine.
but it's not until they get their first pair of glasses or contact lenses that they realize that the world around them is clearer than what they were used to. So how do I know if I have vision problems? The first way to detect vision problems is by using an eye chart, such as the one that we have here on this slide. These eye charts are normally found in medical offices, optometry offices, and the DMV. Each horizontal line on the chart corresponds to a certain number, and that number indicates how your vision is. As some of you might know, 20/20 vision is considered perfect vision. But what does that really mean? It means that you can see letters or objects that are 20 feet away clearly. So, at 20 feet away, a person with 20/20 vision will be able to read the second to last line on this eye chart that we have on the slide. Pretty small, right? If you have 20/40 vision, it means that you can see at 20 feet what a person with 20/20 vision can see at 40. In other words, if two people are placed 40 feet away from an object, and one of them has 20/20 and the other has 20/40 vision, the person with 20/20 will have no problem seeing the object that's at 40 feet. However, the person with 20/40 would have to move closer to the object, and it won't be until they're 20 feet away that they'll finally be able to see the object clearly. This is important to understand because in order to drive, you need to be able to see 20/40 with both eyes, either corrected with glasses or contact lenses or uncorrected. If you find that it's difficult to read smaller letters at a comfortable distance, if you're straining to read a book, or find yourself having a headache after reading something for a long period of time, then it might be time to consider the use of corrective lenses.
How do I know if I have vision problems? You can utilize a near chart, which is a mini eye chart, to test your vision at home to see if you have difficulty reading up close. You can also simply use any small print, like a newspaper or book, that you often read, since the main purpose of this test is to see if your vision is sufficient for your daily needs. It is best to hold your chart or book at a comfortable distance, which is about 16 inches away from you. Starting around 40 years old, you might start to notice that reading things up close are getting blurry. This can have a simple fix with over-the-counter reading glasses. You can also bring the near chart or other small print with you to the store to test out which of those reading glasses are best for you. However, you might also need prescription glasses or may have other issues that you may not know about. That is why it is important for you to have your eyes checked by an optometrist on a regular basis. So, what is an optometrist? Optometrists focus on general eye health and routine vision care. They specialize in detecting and treating poor vision, eye injuries, and eye diseases. They also provide prescriptions for glasses and contacts. You may have also heard of an ophthalmologist. Ophthalmologists are doctors who specialize in more advanced eye diseases and also perform eye surgeries. They also treat diseases and visual complications that are caused by other conditions like diabetes. Here are some symptoms that you may experience that should prompt a visit with an optometrist. These symptoms include decreased vision, floaters, which are tiny specks that appear in your vision, draining or redness of the eye pain, double vision, circles or halos around lights, and flashes of lights. Improving your eyesight is important, but it's just one of the reasons to get your eyes examined. Regular eye exams are an important part of finding eye diseases early and preserving your vision. Eye diseases are common and can go unnoticed for a long time. Some have no symptoms at first. Some eye diseases can lead to vision loss, so it is important to identify and treat eye diseases as early as possible. Your eyes are also a window into your health. Not only can you be diagnosed with conditions such as glaucoma and cataracts, which only affect your eyes, but conditions that affect your entire body, like diabetes and high blood pressure, which can also affect our vision.
Astigmatism is when the lens of the eyes is curved, and it can happen whether you have near or far-sighted vision. So imagine your eye is like a round ball. Sometimes instead of it being perfectly round, it's a little more like a football. That's what we call astigmatism. It just means your eye isn't round. but don't worry, glasses or contacts can help make things clear and sharp again. Astigmatism is common and generally treatable. Most of the time, it's not even severe enough to need correction. Some symptoms that you might notice with an astigmatism is if you're feeling like you have any eye pressure, or if there's discomfort in your eyes. Sometimes you might get a headache. You might have difficulty with night vision. So when you're driving at night, like in these pictures right here, you notice that these lights are kind of like spreading out further than they really are. You might feel like you need to squint more, or you might notice that your eyes are blurry. So when is it important to see an eye doctor about whether you have an astigmatism? Typically, when it messes with how you complete everyday tasks or if it keeps you from enjoying your activities.
All right, and then another example of an eye symptom is called floaters. So normally these are just an unfortunate part of getting older, and normally these are benign. They can look like these little floaters or dots in your vision. Again, most of the time they are benign and go away over time, but if you notice that these spots are getting bigger or more persistent and aren't going away over time, it'd probably be a good idea to go to your local eye doctor to get things checked out, as they could mean a more serious complication is occurring.
Cataracts is very common and is the leading cause of vision in the United States. It is the clouding of the lens in your eyes, causing haziness of your vision. Cataracts may cause you to have blurry vision, difficulty reading in dim light, poor night vision, glare and halo around lights, and sometimes double vision. If this sounds like you may have cataracts and should you get your eyes checked.
Okay, so now we're going to talk about glaucoma. In our eyes, we have a nerve in the back of the eye that connects to our brain. It's called the optic nerve, and this nerve sends visual information from your eye to your brain, and that's how we interpret what we're seeing around us. Damage to this nerve is often related to high pressure in your eye and can cause a loss of vision in your peripheral vision or the outside edges of your vision, like you see in the photos here. Glaucoma can occur at any age, but it's more common in older adults. Many forms of glaucoma have no warning signs, and the effect is so gradual that you might not notice a change in vision until the condition is in its later stages. It's important that you have regular eye exams that include measurements of your eye pressure. If glaucoma is recognized early, vision loss can be slowed or prevented. Once you have glaucoma, it is permanent and you'll need treatment or monitoring for the rest of your life. So that's why we really encourage you to follow up with your eye doctor regularly to stay on top of your eye health and prevent conditions like this.
Diabetic retinopathy is a common complication of diabetes. It happens when high blood sugar levels begin to damage the blood vessels in the back of your eye. The back of your eye is important because it contains the light-sensitive part of your eye, so any scarring or damage to this area can cause permanent vision loss. There might not be any symptoms in the early stages, but as the condition worsens, you may begin to see floaters, have blurry vision, dark or empty areas in your vision, such as what we have an example of the slide. The right side, you can see how there's the dark and empty areas that are obstructing or blocking the vision of the person. Diabetic retinopathy is also one of the most preventable causes of vision loss and blindness. So as a diabetic, it is important to control your blood sugar levels and get your eyes examined every year to protect and preserve your eyesight.
You should get your eyes checked every 1 to 2 years, or if you have any new vision problems. And just as it is important to keep your body healthy, you also need to keep your eyes healthy. These exams typically last about 45 minutes to an hour, depending on where you go. During the exam, the optometrist checks many things in your eyes, including how well you can see, eye alignment, eye movement, and eye pressure. A dilated eye exam is also necessary to find eye diseases, hopefully catching them early to prevent any vision loss. To dilate your eyes, special drops are used to make your pupils larger so your eye doctor can see inside your eyes and check for signs of health problems. Your eye doctor may even spot other conditions such as high blood pressure or diabetes, sometimes before your primary care doctor does. Just a note, if you get your eyes dilated, it is not recommended to drive 4 to 6 hours afterwards, so you may require some planning beforehand to have someone drive you home after. Now I'm going to go over some eye care tips. First, you can eat a healthy, balanced diet. As mentioned earlier, your diet should include plenty of vegetables, especially green leafy vegetables. Eating fish high in omega-3 fatty acids can also help your eyes. Next, you can maintain a healthy weight and get regular exercise. Being overweight or having obesity increases your risk of developing diabetes. Exercise may also help to prevent or control diabetes, high blood pressure, and high cholesterol. These diseases can lead to some eye or vision problems, so it is important to exercise regularly to help your eyes. Additionally, you can avoid smoking because it increases the risk of developing age-related eye diseases. You can also wear UV-protected sunglasses, since sun exposure can damage your eyes and raise your risk of cataracts and other eye diseases. Using polarized glasses only help to remove the glare, but does not help with your eye health, so it's important to wear UV-protected sunglasses. You should also wear protective eyewear when playing certain sports, working in jobs such as construction, and doing repairs or projects in your home to prevent any eye injuries. Lastly, you should give your eyes a rest. If you spend a lot of time using a computer, you can forget to blink and your eyes can get tired. To reduce strain, try the 20-20-20 rule. Every 20 minutes, look away about 20 feet in front of you for 20 seconds.
All right, okay, so now we're going to go ahead and go over some resources. All right, so on the back of your insurance card, there should be a number. You can call that number to go ahead and get a list of in-network providers that are available for you. And then during that time, that's when you would pick your primary care physician. So that would be the doctor that you see whenever you're sick or not feeling well. And then your insurance would be able to tell you at that time what your deductible is.
So many of you might already be familiar with St. John's Rise Reentry Program. And we love this because it's a one-stop shop for all your medical care. They accept Medi-Cal, but you do have to be under the St. John's Medical Group in order to receive services that are covered by Medi-Cal. So in case you're assigned to another medical provider or to you have private insurance or you have no health insurance, St. John's also provides a sliding scale that's based on income. So depending on how much money you make, you can be offered relatively cheap prices for the services that you are provided. Some of the medical services that you can get at St. John's are COVID testing, screening for diabetes, high blood pressure, asthma. You can get a variety of different optometry services, such as the complete eye exams, and you can also get low-cost dental services, including the fluoride treatment that I talked to you all about previously.
Okay, now we're going to transition into giving you some dental care resources. If you have Medi-Cal Dental and do not have a dental provider or a dentist that you see regularly, you can go on to these two websites listed to help find a Medi-Cal dental provider in your network and also learn more about oral health resources that are available to you. Here are some more dental resources. Again, we recommend calling your insurance if you do have dental insurance to get a list of in-network providers. But if you do not have any dental insurance, we have listed some cash resources. There's Cypress College Care Dental Center and the Wilson Jennings Bloomfield UCLA Venice Dental Center. All of these are pretty local to Mass Liberation, and they are all dental schools. So the exam and the cleaning is done by a dental hygienist student, but they are supervised by a licensed dental hygienist and a dentist. But these options are generally a little bit more affordable to get a cleaning. If you do have Medi-Cal Dental, there are two options that are listed for local dentists that do accept Medi-Cal Dental. So there's the dentist of Gardenia and also St. John's.
This picture shows many services that Medi-Cal covers during your dental visits, from when you're a baby to when you're a senior. It is important that you take advantage of these opportunities to prevent or treat any health concerns that can lead to more serious health problems. You can see in this picture that Medi-Cal does provide a lot of services, from just a dental exam, taking x-rays, your teeth cleaning, getting any filling, or even tooth removals. Sometimes even getting your tooth removed could be pricey, so it's important that if you have Medi-Cal to use these services as much as you can.
Now we're going to transition into talking about eye care resources for eye examinations and also glasses.
All eligible members are offered a routine eye exam which checks the health of the eyes and tests for an eyeglasses prescription once every 24 months or 2 years. Eyeglasses, including frames and lenses, with a valid prescription is also covered once every 24 months or 2 years. Depending on the location, they will have a section of covered glasses you can choose from at the eye clinic. Unfortunately, contacts are usually not covered, but it may be covered if the use of eyeglasses is not possible for the patient. Due to eye diseases or conditions such as, for example, if you're missing an ear and glasses cannot be worn, then contacts possibly would be covered under Medi-Cal. Medi-Cal also provides specific vision tests and eye services or materials for people who have lost an eye or eyes to diseases or injury and is not correctable by standard glasses. If you require more than eyeglasses, Medi-Cal covers the diagnosis, treatment, and management of eye diseases. You may need to visit your primary care provider to get a referral to see an ophthalmologist if your condition needs management of diagnoses such as glaucoma, cataracts, diabetic retinopathy, and other diseases. Typically, these types of conditions like glaucoma, cataracts, diabetic retinopathy tends to have a more extensive need for treatment. So you might have to go see your family doctor to get a referral to see the ophthalmologist instead of an optometrist.
We have listed some eye care resources to get an eye exam for both cash pay options and Medi-Cal options. If you do not have any optometry insurance, you can do self-pay, so you can go in and pay cash for your eye exam. We have listed a few different resources like JCPenney, Walmart, Warby Parker, Target, and Costco. These are all fairly local options, and the price usually ranges from about $60 to $80 or $90. If you do have Medi-Cal optometry insurance, you can go to St. John's, or Ketchum Health is another option. Those eye exams are performed by optometry students, but they are supervised by licensed optometrists, and they do also offer eye exams on a sliding scale, so the cost of the eye exam will be determined by your income. So those are a few different options for you if you need an eye exam, for both if you don't have insurance and if you do. The last resource that we wanted to share with you is for prescription eyeglasses. If you do find that you need glasses, you can go on to zenni.com or eyebuydirect.com, and you can input your prescription and you can have the glasses shipped directly to your home. And this is a good affordable self-pay option for either prescription glasses or prescription sunglasses. If you find that you just need help with up-close objects or reading, you can purchase non-prescription reading glasses over the counter. And these are generally about $5, and you can find these at your local CVS, Target, Walmart, or even Dollar Tree.
All right, so that concludes our entire presentation. Again, we wanted to just say thank you so much for taking the time out of your day, and we hope that you gathered some valuable information. Thank you. Take care.